Going to review the post-kidney transplant education slides today. Please open up your binder and turn to the tab that is labeled Education Slides in order to review these as we chat. Please keep in mind that you will get to speak with multiple members of the transplant team to offer clarification on these slides, including the nurse, the dietitian, pharmacist, social worker, financial assistant, and many more providers of the team. So we'll go through this, but you will have time to review all of this information with real people. Section, we're going to talk about preparing for discharge and what to expect during the hospital stay. We'll be cared for by both inpatient hospital members and outpatient transplant team members. The transplant team will provide all of their education while you're in the hospital. We will try to plan your discharge date as far in advance as possible to ensure that you can arrange for transportation and support. We'll also try to communicate any, heavy education days with your caregiver and you as much as possible so that they can be present for education meetings and discharge planning. The typical hospital stay is about 4 days. Sometimes it's less, sometimes it's more. It just depends on your specific course. This slide highlights the importance of a caregiver. This is just to ensure that you have an extra set of eyes and ears. There's a lot of information that comes at you during this time, and the patient is often, medicated on pain meds, and so we want to make sure a caregiver is present to be aware of medications, follow-up plans, and what possible complications to report to the transplant team. In order to go home, we need to make sure that you feel strong enough to move around your home safely. So some things to think about. How far do you have to walk to get to a bathroom? Can you get on and off the toilet in your home? Can you make it to the kitchen? Are there stairs to get up? So those are things to think about. If you do not feel strong enough to be safe in your home, please tell someone. We do have physical therapy and occupational therapy services in the hospital should we notice you're a little weak, but it's important you communicate to us well in advance. Prior to discharge, we want to make sure that you're moving around safely, your pain is well controlled, you're eating and drinking okay, you're tolerating your medications. You might have a Foley catheter right now, but you will likely have that removed before you go home, and we want to make sure that you are peeing on your own. And if you're not having bowel movements yet, we want to make sure that you're showing signs of having bowel movements, passing gas, that kind of thing. Be ready to go home safely. We want you and your caregiver to know your new medications, how much and when to take them. You're not going to be an expert on your medications right away. It is a lot. However, you should have a good idea of the meds you're on, why you're taking them. You should know where you can look, who you can call if you have any questions on your medications. You should know signs of organ rejection, infection, or other complications, how to prevent these complications, your follow-up plans, and how and when to contact us. Next section covers the ureteral stent. We'll likely have a ureteral stent. Most patients have one of these placed during transplant. If you don't know if you have one, make sure you ask. Basically, this stent is a small flexible tube. You can think of it kind of like a straw placed inside the ureter of the transplanted kidney at the site where your new kidney attaches to your bladder. So the ureter is the tube that drains the urine from the kidney into the bladder. And we place a stent in there for about 2 to 4 weeks in order to hold that ureter open while everything heals and make sure the urine is flowing in the right direction. Your stent will be removed. It's about 2 to 4 weeks after your transplant. This will be performed during a short outpatient clinic visit. So you'll be awake during this removal. It is short. They use some numbing solution, and basically similar to a catheter, go in, they're able to visualize the stent, they more or less grab it and it pulls out. We help to make sure that that gets scheduled in the right amount of time. One thing to note is you will need to take an antibiotic prior to your stent removal. So you will get this prescribed to you before leaving the hospital. It may be 1 or 2 pills, depending on the antibiotic you're given, but it's in one pill bottle, and it'll be a single dose, and there will be a note on it that says something like, take prior to stent removal. And this is to prevent any infection associated with that removal. This next section is on tubes, drains, and dialysis access. We'll have a urinary catheter. This is in order to measure the amount of urine that you're making sure that kidney is working really well. It also allows your bladder to rest and heal. It is in for at least 3 to 4 days. A lot of times it's in until the very last day that you're here. Sometimes people have to go home with a catheter for a short period of time. If you do have to go home with a catheter, you will get specific instructions from your nurse and some extra supplies on how to care for it and how to empty the urine, that kind of thing. Central lines, you will wake up with a central line. It is often placed in your neck, depending on your vasculature. We put a big line like this in during surgery in order to keep you safe, but also to give you a lot of specialized medications, big immunosuppression meds that would be hard on those smaller veins in the arm. This will be removed prior to going home. You might have something called a Jackson-Pratt drain. These are little bulbs, basically. They are usually placed near your incision site, and it helps to remove any extra fluid from around your new kidney. Sometimes you go home with this drain for, a few days to a couple weeks, depending on how much output you're having. A lot of times it is removed before you go home. If you go home with the drain, the bedside nurses will show you how to empty this drain, how to keep track of the output, and how to care for it. If you had a peritoneal catheter, sometimes we leave these in for a short period of time after transplant. This is the same for a hemodialysis catheter. Basically, we just need to care for that like you did prior to the transplant. And we will plan for the removal of these devices at Porter during a short procedure in which you should be able to go home that same day. If you had dialysis performed through a fistula, we typically leave this alone. This is to ensure that you have access for dialysis in the future should you ever need it. Is on post-transplant medications. This is a lot of information, and this is really the bread and butter of what we do. Our pharmacist will be speaking with you and we'll go into a bit more detail on this. So we kind of just breeze over these slides a bit. They're there for you to reference, but it's really important that you follow our pharmacist instructions specifically, as they will have this exact medication regimen that you will be on. So a good rule of thumb with your new medications is to, by day 1 and 2, kind of familiarize yourself with these meds. Ask the nurse questions when they're giving you the meds. What is the name of this med and why am I taking this med? After day 3 to discharge, we want you to be able to start naming them and to be able to tell the nurse while you are taking each of them. Transplant medications, they will initially be filled at our specialty pharmacy in our hospital. This is to ensure that you have everything you need when you go home. They're going to be delivered to your room prior to discharge. The delivery includes a blood pressure cuff, a pill cutter, a pill box, and thermometer for you. The next section just kind of talks about the benefits of using a specialty pharmacy. Our pharmacist will chat with you about that. It is really dependent on what type of insurance you have. Sometimes they prefer you to go to one pharmacy over the other. But we do prefer specialty pharmacies when it comes to immunosuppression medications, just to ensure that they are refilled appropriately and billed appropriately. So, like I said, our pharmacist will chat with you more about details regarding your specific pharmacy preferences. The facts of transplant life. So if we only did the surgery and gave you no medications, your immune system would reject your new organ. It would recognize this kidney as foreign and it would attack it, because that is what our immune systems are supposed to do. So you need to take medication to lower your immune system for life in order to prevent that from happening. So you will be on immunosuppression for life. And that is why it's so important to learn what medications you're taking. You're going to always need to take them in order to keep your kidney happy and healthy. So never stop these medications. If you're having any problems getting your meds, whether it be for financial reasons or pharmacy issues, please call us right away and we will pool our resources together to help. So we include a section on transplant rejection here, as it is highly associated with transplant medications and your immunosuppression. So rejection means that your immune system has recognized your new kidney as foreign and has started attacking it. A lot of times you hear the word rejection and you think that, that's it as far as the kidney goes, that it's done. It could be that, but it also can be, it can range from mild to severe rejection. And what's really important is that we catch it early so that we can treat it. So this is typically found through abnormal lab results. That's usually the first sign. Sometimes people have symptoms including weakness, increased fatigue, fever, pain over the kidney site, swelling, changes in urine output, changes in blood pressure. But you may not have symptoms. Oftentimes we just catch it in your labs. In order for us to know for sure if you have rejection or not, we have to do a biopsy of the transplanted kidney. Depending on the type of rejection you have, we can treat it with different types of immunosuppression medications. Sometimes it's mild enough to just do some oral steroids, and sometimes it's severe enough that you need to be admitted to the hospital for IV medications. So this section just kind of goes over common transplant medication regimens. The transplant pharmacist will let you know specifically what regimen you will be on, but the anti-rejection or immunosuppression medications, you will be on some combination of those for the rest of your life. There will be some anti-infection medications. These are included because in the very beginning of transplant, we give you a lot of immunosuppression meds. So while you're in the hospital, you get a lot of those, and your immune system is really weak because of that. So you're at an increased risk for certain viral and bacterial infections. And so you'll be on a course of antibiotics and antivirals from 3 to 6 months. And the transplant pharmacist will specify which ones you will be on. So this section goes over one of the immunosuppression medications we use. So typically you'll be on tacrolimus. This one is taken every 12 hours. And the big important part of this is we monitor how much tacrolimus is in your blood with every blood draw. And we do this by measuring the amount in your blood right before your first dose in the morning. So we want to take your blood prior to you taking your morning pills. This is to make sure that you don't have too much of the medication, which can be harmful to you, or too little of the medication, which would be ineffective at suppressing your immune system. So it's not uncommon for us to change this medication dose pretty frequently in order to make sure that you have a good amount in your system. But with every blood draw, really for the rest of your life, we will be wanting to measure how much of this medication is in your system. And for that reason, it is good practice for you always to get your blood draw in the morning before your medications. Often on one of these medications as a second line of immunosuppression, the pharmacist will specify which one you're on. Fortunately, this medication, mycophenolate, does not need monitored in your blood system like the tacrolimus. It does have some possible side effects listed here. One of the big things with this medication is that it will cause birth defects if taken during pregnancy. So we do want you on a birth control measure should you be of childbearing age. And if you plan to become pregnant, please notify us and we can modify your immunosuppression medication regimen so that it is safe for you to do so. Prednisone. This is a steroid. Some people require prednisone daily for the rest of their life, depending on their history and specific cause of transplant. However, a lot of people will just require prednisone while they're in the hospital and not require it after going home. So it just depends. It lists here some side effects and long-term risk associated with the drug. And like I said earlier, there will be some short-term medications just because of your increased risk of infection. So an antiviral, a lot of the antivirals end with vir, V-I-R. Think vir is for virus. A lot of the antibiotic we typically use, is called Bactrim. So think Bact for bacteria. Sometimes you'll be on an antifungal, and sometimes maybe like an antacid to reduce risk for stomach ulcers with all of these new medications. So this section just highlights again the importance of needing to take your medications for the rest of your life. If you experience any unpleasant side effects, please let us know. Don't stop taking your meds. Let us know and we can make adjustments. There are other options available. Basically, taking your meds is essential for the life of your new organ. So missing medication doses will allow your body to start attacking and harming your kidney. And this is responsible for a lot of organ losses because people stop taking their meds or forget doses. If you do miss a dose, take as soon as you remember, if it's within a few hours. Never take 2 doses at once. Never try to make yourself vomit if you think you took too much. Just call us, call your nurse coordinator, and we will help. Additional lab work may be needed in order to ensure everything is steady. Drug interactions. So there are a lot of possible interactions with these meds, and there's some adverse effects associated with that. So basically, always ask about interactions when you're starting or stopping any prescription or over-the-counter medications or herbal medications. We don't want you to have any grapefruit, pomegranate, or starfruit. either the actual fruit or the juices. Basically, the golden rule is to always ask before starting anything new. Brand name versus generic medications. These are usually not a huge issue. It's really just about being consistent. So if your pharmacy says, you were on the generic, but we have to switch to the brand name due to supply issues, it's usually okay as long as you're not switching back and forth between these two with every other dose. If you have any concerns, please, call us and we can help guide you. Blood sugar monitoring. So when you're in the hospital, we give you a lot of steroids. So even people who are not diabetic oftentimes have high blood sugars. For those that are diabetic, it's usually, you need to start insulin or you require more insulin. If for some reason you require insulin or need to go home with a blood sugar machine and this is all new for you, we will provide education on how to manage this. It's important that if you are diabetic, you have good follow-up with either your primary care doctor or your endocrinologist just to manage your blood sugar after a kidney transplant. A type 1 diabetic and use an insulin pump, we want you to know that this is usually removed during your inpatient stay. This is for safety purposes, as the doctors want to manage and administer controlled insulin doses and know exactly how much you're getting. This next section is on lab draws. So labs are really important. So the blood work often shows complications before you are having any symptoms. It tells us the health of your new organ, if you're having any infection or rejection, and if you're taking the right amount of medications. Expectations. So labs are going to be a part of your life forever, more or less. In the beginning, they'll be very frequent and they will eventually become less frequent, but they will always be something that you'll have to have done. So you must always know when your next blood draw is due, what lab you're going to use, how you're going to get to and from the lab. So if you're having any difficulties getting labs done, please keep us in the know because they are very important for your post-transplant course. So in the beginning, like I said, it's very frequent, so you don't have to memorize this, but the first month we do labs twice a week. The second month we do them weekly. The third month we usually do them every other week. And then after 3 months, we hope to go monthly. We will let you know your specific schedule, especially in the beginning when we're seeing you so much. But as you go further and further out, after year 3, you'll only need labs every 3 months, but you will need them at least every 3 months for the rest of your life. And it has to be on your radar when your next labs need drawn. So as we talked about, we monitor the level of medication in your blood with every draw. So we always want your blood draw in the morning before you take your morning medications. Otherwise, this level will be wrong. Even if it's like 5 minutes, I took my meds, 5 minutes later, I got my blood drawn, it can sway this number and we can inappropriately adjust your meds. So do your best to make this happen and then just be honest with us if you made a mistake and took your meds before your blood draw. This next section is on diet and nutrition. You will see a transplant dietitian who will go over this in more detail and can help answer specific questions. So the post-transplant diet, we really want it to be a balanced diet. We want you to maintain a healthy weight. Water is best. So we want 2 to 3 quarts or 1,500 to 2,000 milliliters of fluid every day to avoid dehydration. Water is our best option. We want you to limit high sugar containing drinks, avoid large amounts of caffeine, and we don't want any grapefruit or pomegranate juices as these can interact with your meds. Your electrolyte intake may need to be monitored, so especially in the beginning, we're going to be watching your potassium, your phosphorus, your magnesium, and we may have to, modify your diet in the beginning in order to get those leveled out. And we want you to limit high sodium foods. After your transplant, proper nutrition is very important to help you recover and prevent illness. So good nutrition can prevent infection. We want to prevent foodborne illness or food poisoning. We want to build muscle. We want to maintain strong bones, control blood sugars, and maintain or achieve a healthy weight. So food safety, there's a lot of sections on food safety, and this is to prevent that foodborne illness. So we don't want any food poisoning. Just bear in mind that, small food poisoning for someone else may be, mild, but for you with immunosuppression meds, it can be very severe. So we want to wash our hands. We want to, prepare food safely as far as washing surfaces, washing fruits and vegetables, using clean silverware, etc. Thaw foods in the refrigerator under cold running water. Don't leave it out overnight to thaw foods, anything risky like that. For proteins, we don't want you having any raw or undercooked meats, poultry, fish, or eggs. So we want you using that meat thermometer. We want eggs whites to be cooked until solid. Deli meats or cold cuts, they need to be heated to steaming. Unfortunately, this means we want your steak cooked well done. We want it cooked fully. So no raw or undercooked meats, poultry, fish, or eggs. Dairy products, including milk, cheese, and yogurt, we want them all to be pasteurized. So some soft cheeses or, farm-to-table dairy products may not be pasteurized. So just be sure to read the label on these. And then live by the expiration dates on dairy, but really all products. If you have to smell something to see if it's still good after the expiration date, just don't do it. So fruits and vegetables, we want everything washed thoroughly, even if the prepackaged vegetable package says that it was washed 3 times. Sometimes they have those vegetable cleaning sprays, but these often contain grapefruit oil, which would be problematic, so just be mindful of that. We don't want anything unpasteurized as far as cold-pressed fruit or vegetable juices. Avoid raw alfalfa sprouts and bean sprouts. Once again, avoid the grapefruit and pomegranate. And then we want to avoid raw honey. As far as leftovers go, just using common sense. We don't want to eat any leftovers that have been at room temperature for longer than 2 hours. Leftovers, you should be eaten within 3 days or frozen and thrown out after that time. We want leftovers reheated thoroughly to 165 degrees Fahrenheit. And refrigerators should be kept at 40 degrees or less to prevent bacteria growth. You are allowed to dine out. In the beginning, in the first couple months, you'll be at a greater risk for infection, so maybe avoiding it initially. But if you do go out, just following some simple guidelines, making sure you go to places that are generally clean, look at how the food is being served. Don't be afraid to ask questions about how the food is prepared. Make sure you tell the staff that you cannot have any food containing raw or undercooked meat, poultry, fish, or eggs, and then make another selection if you're doubting whether or not the food is prepared safely for you. We generally advise avoiding buffets as some things can be undercooked or they can be at room temperature for too long. Making sure that if you do have leftovers, refrigerate them as soon as possible. Don't leave them in their car for too long. And if it is in temperatures above 90 degrees, refrigerate it within an hour. So for shopping for food, checking expiration dates, avoiding damaged goods, anything that looks spoiled. If you live really far away from the grocery store, it's good to carry, cooler bags or ice packs to ensure things stay cold and putting groceries away quickly when you arrive home. So diet after transplant. So we really just want a heart healthy diet. And also, if you're diabetic, we want you to follow a diabetic diet. Lean protein, such as, fish a couple times a week, poultry without skin, lower fat pork and beef cuts, low fat dairy products, a good variety of fruits and veggies, making half of your grains whole grains, avoiding, any additional salts or sodium products, and choose heart healthy fats such as olive oil, canola oil, and avocados. All right, so moving on to the incision care and infection prevention section. So incision care, we want you to shower daily. So we want the warm soapy water to rinse over the incision site. We don't want you scrubbing that site. We want you to carefully pat the incision with a clean cloth to dry. We don't want you scrubbing anything. We don't want you to apply any ointments to the incision unless we instruct you to. We don't want you to soak in a bathtub, hot tub, go swimming, or submerge that incision for about 6 to 8 weeks, depending on your healing. If you do have staples, it's okay for these to get wet in the shower. And we will remove your staples if you have them in about 2 to 3 weeks. You might have something called a perineo dressing, and this is a clear dressing over your incision. If you do have one of those, these will stay on for about 3 weeks. You can shower with these in the same way, just kind of let the soapy water run over the dressing and the incision and then pat dry. At around the 3-week mark, you need to start gently rubbing the incision and the perineo dressing with soapy water when in the shower to facilitate the removal of the dressing. It'll kind of naturally fall off, but if you're experiencing resistance, it's really stuck on there, don't pull this off. We can assist with the removal of it in clinic. So regardless of whether you have staples or a perineo dressing, we want to monitor it for signs of complications or infection. So it may be light pink in color. There may be some clear or straw-colored drainage. Signs of infections or complications, the wound will start looking darker in pink or red. You may notice there is more drainage or swelling. The drainage may be yellow or green or just foul smelling, and there may be increased pain. So if you think that your incision is infected or if it's looking funky, please notify us. We will be peeking at it in clinic, but it's important that you keep us in the know if you notice any changes. So infections can occur following surgery. We want to make sure you're watching for signs of these, including a fever above 100.4. We want you to take your temp every day. We want to look for body aches, chills, increased fatigue. And those that are greater than 60 years old, sometimes confusion is the first sign of infection. So caregivers should be aware if, they're acting a little confused that day, that we need to know about it. A cough or chest congestion and persistent watery diarrhea could also be signs. So there are steps to prevent infection. The incentive spirometer that you're given in the hospital here is important to keep using until pain is gone and your activity is back to normal. A lot of times when you're hurting, You're not moving around as much, and you're also not breathing as deeply because it kind of hurts your belly. So for this reason, your lungs kind of shrivel up and they don't expand as much as they need to. So we want you to take this incentive spirometer home and keep using it, keep opening up those lungs to prevent pneumonia. Once you're pain-free and you're moving around, you don't need to keep using this. We want to take care of your dressings, your wounds. Like I said, if at all possible, we want you showering daily. We want you to stay active, so moving around as much as you can as far as walking, gradually increasing your activity does help to prevent infection. And then getting your lab work done and keeping follow-up appointments with us, as the first sign of an infection is often found in your lab results. And also, you need to take your medications. The medications you're on, especially the anti-infectives, are going to prevent infection. So some common sense, thorough and frequent hand washing, use of hand sanitizer, and then avoiding people that are sick, or if you must be around someone who is ill, wear a mask. This is particularly important in the beginning, the first 3 to 6 months, you're at an increased risk. So maybe avoiding large crowds where you would be exposed to something outside of your control, or wearing a mask if you're in those situations would be helpful in preventing infection. So long term, so you're going to be on immunosuppression medications for life, so you will have a lifelong risk of increased infections. So like I said, practicing common sense, thorough hygiene, food safety, and regular follow-up can help prevent infections, and then notifying your transplant team with any signs of infections or other concerns. And it's on organ rejection, which we've already touched on a little bit. So organ rejection is when the kidney is recognized as foreign by your immune system. Signs of rejection, oftentimes you don't have signs. We usually catch them in your labs. But if you do have signs of rejection, they're actually similar to signs of infection. So just some generalized discomfort, not feeling good, pain or swelling over the site of your organ, some flu-like symptoms. Some people have shortness of breath. Some people have fevers, but it's common to not have signs. So if you're having signs and symptoms of any of these, please let us know. The first signs will likely be found in your blood work. If necessary, a biopsy of the kidney may need to be performed in order to confirm or rule out rejection. Treatment for rejection may involve an increase in your anti-rejection medications or an additional anti-rejection medication. Sometimes it's severe enough to require hospital admission to treat. The control you have over rejection is taking your medications as prescribed without missing any doses, and also following up with us as scheduled, getting your labs as scheduled in order for us to catch anything early. Activity after transplant. So returning to a new normal. So recovering from surgery takes time. Do not push, pull, or lift anything greater than 5 to 10 pounds for 8 weeks. We put that range there because everyone's a little different depending on their fitness prior to transplant. So ask questions if you have specific, what your restrictions are from the surgery team. But the big rule of thumb is that you just need to listen to your body. So your incision is over your abdomen, your muscles in your abdomen were cut into, and we want to make sure that is all healed in order to prevent complications such as hernias. So listen to those abdominal muscles. If it feels awkward, you probably shouldn't do it as far as pushing, pulling, lifting, twisting. We do encourage walking and getting up and out of bed. Gradually increase the activity that you're doing and distance traveled. But ultimately, you really need to be gentle with your abdomen for 8 weeks after surgery. We want you to avoid contact sports, no sit-ups or abdominal exercises for the first couple of months, 2 to 3 months, depending on the person. Basically, ask your doctor if you have any questions about a specific activity. Healed exercise is encouraged. This looks different for everyone. Do what works for you and your body. But we encourage exercise in order to control weight and prevent long-term health issues associated with your transplant medications and other diseases. Driving. It's different for everyone. We say at around 3 weeks, we usually allow everyone to go back to driving. If you are pain-free and not taking any meds and your reaction times are good, and you and your family and the doctor all agree on it, we can maybe go sooner than that. But it is in an effort to keep you safe and keep others on the road safe. Of course, we always want you to wear your seatbelt to protect your gift of life. So post-transplant care and long-term health concerns. So this is a lengthy section. It's looking a little bit more into the future and what to expect. So this just explains kind of what the transplant clinic looks like. So in the beginning, you're going to return to the transplant clinic frequently. Eventually, you don't have to come as often. Telehealth visits are an option for some patients, especially for those that live a distance away and are tech savvy. Eventually, into the future, we only need to see you every 6 to 12 months. If there are complications or concerns, we may need to see you more frequently. A caregiver should attend all visits with you until you can safely drive and manage your care. There's a lot of information, as you can imagine in the beginning. There's a lot of changes to your medications. There's a lot of fluctuations in your blood pressure and your labs, and it's a lot in the beginning. So we would prefer, if at all possible, a caregiver there in order to help you manage that. As a reminder, you should not take your morning medications until after your blood draw. We do want you to bring those morning meds with you to clinic so that you can take them as soon as your blood is drawn. Sometimes the clinic visits can go long, and we don't want you to have your meds at home and you be hours late for your morning pills. So bring them with you to clinic. We want you to bring a current list of your meds, and then we want you to bring logs of your blood pressures, your blood glucose levels, if applicable, your temperatures, etc. So there is a section in your binder called the home monitoring log, and the nurse will go over which values you need to monitor specifically. But it's important that we review that in clinic with you in order to make adjustments as needed. So looking into the future, routine health care. So we will manage your transplant specific care, but it is important that you have a local doctor for routine care, such as those annual physicals and routine vaccinations and cancer screenings, depending on your age. So schedule an appointment to see your local physician in the first couple of months after your transplant. They need to know that you had a transplant, and we need to make sure that you're getting appropriate care from them long term. If you do have a local nephrologist or a kidney doctor, we usually refer you back to them within the first year, and we work with them to provide you the best care. So it's a collaborative effort with them. So this goes over the common post-transplant health issues associated with transplant, which we'll go into more detail in the next coming slides. So heart disease. So this is why when we were in the diet section, we talked about needing to do a heart-healthy diet, because it is a big problem after transplant on these meds, high blood pressure, high cholesterol levels, heart disease in general is an issue. So healthy diet, we don't want you to smoke. We want to control your blood pressure. So we're going to have you monitor your blood pressure at home and take any meds as you need to. We're going to watch your cholesterol with your local provider, as everyone has to once a year. Control diabetes should you have it, and maintain a healthy weight. So high blood pressure is common after transplant, and the issue with this is it can damage your new kidney, and it can contribute to other scary issues, including heart attacks, strokes, and diseases of the blood vessels. So the meds you're on, while they're great, they do contribute to high blood pressure. So we want a heart-healthy diet, a low-sodium diet, weight loss or maintenance, and exercise, and medication if needed. Obesity and weight gain, this is a little bit more common in those that need to be on prednisone or steroids long term, but it can happen to everyone, partly due to medications. Typical weight gain is about 15 to 20 pounds, which of course increases your risk for diabetes, heart disease, and may reduce your quality of life. So we want you to avoid this by keeping track of your intake, avoiding sugary beverages, fast food, highly processed foods, cut out those in-between meal snacks, and increase your exercise as able. If this becomes an issue for you, please let us know. We have dietitians on staff and resources available to you. Cancer prevention. The most common post-transplant cancer is skin cancer, specifically basal cell and squamous cell carcinoma. We want you to prevent this, of course, by avoiding sun exposure when possible, wearing long sleeve shirts, big hats, at least SPF 30 or greater. And then we're going to want to make sure that you see a dermatologist once a year for a skin exam. So even if you think your skin looks great, we want you to see a dermatologist because it is that common. Just to do a routine check once a year on these medications, which you will be on for life. So, and then of course we want to know about any ulcers, changes in moles, or pigmented spots on your skin. Notes on cancer prevention. So we always want to get your labs drawn on time. Some abnormal labs can catch certain cancers. And then we want you to just get routine cancer screenings. So whether it be pap smears or breast exams or mammograms, prostate exams, colonoscopies. So following with your local primary care doctor about age-appropriate cancer screenings in order to catch things and prevent. We also, of course, no smoking, exercising regularly, and eating a healthy diet can help to prevent cancer as well. So immunizations wise, we like vaccines. We're going to promote that you get routine vaccinations. They are outlined here, but there's always new information coming out and new vaccines. So always ask if you have any questions about them. It should be noted that you should not get any vaccines until you are at least 90 days out from transplant. And that is because your immune system has more or less been wiped out, and immunizations won't work on you well for the first 90 days. After 90 days, you should be good to get vaccines. That being said, you should never have a live virus vaccine anytime after transplant. These would be dangerous for you. So a couple of them are listed here. They are not often given out anymore, the live versions of these. So there shouldn't be many occurrences when you encounter a live vaccine. That being said, it's always good practice to ask and ensure that a vaccine is not a live virus vaccine, as these can be very bad for you. Bone health. So this is especially common, an issue that is common among those who are taking prednisone and among women who are postmenopausal. However, everyone is at risk for this due to the medications. So it's just something we watch. This can be diagnosed with something called a DEXA bone density scan. It is treatable with diet, exercise, supplements, and medications. Sexual drive and health usually returns to normal after you heal from surgery. For women, normal menstruation should resume after transplant. It may, have a little bit of abnormality for a month or two, but should return to normal. And as stated previously, birth control is required for women of childbearing age after transplantation. If you have interest in becoming pregnant, please let us know. For any questions regarding your sexual health, you can chat with us, but we'll probably direct you to your local physician, urologist, or gynecologist. Touched a bit on pregnancy after transplant, but we like to stress that the first year after transplant is a sensitive time, so we do not want you to become pregnant during the first year. There's an increased risk to both the mom and baby. That's why we want you to use contraception if sexually active. Some of the meds that you're on could be harmful to a developing baby. So if you do plan to get pregnant, please discuss this with your transplant physician and coordinator, and we can chat about what's appropriate and refer you to the right people and make sure that both you and baby are safe. So we chatted about this a bit, but other healthy actions, we just want you to have a local doctor who can do physical exams with, order the mammograms, the pap smears, the prostate exams, colonoscopies, all of that stuff, age-appropriate things. We also want you to see a dentist regularly and make sure that you're getting dental cleanings, taking care of your mouth. A lot of times people ask questions, do I need to take antibiotics before teeth cleanings? And generally, we do not recommend that, but it is up to the discretion of the dentist you are seeing. So we're happy to answer any questions for that dentist. So if you don't already, we'll want you to have a MyChart account through AdventHealth Patient Portal. So there's an app on your phone for this. You can use on a regular desktop. We use this platform to perform telehealth visits. So if you live a long distance away and you want to do telehealth, we have to have this system set up for you in order to do that. It's also just a really nice tool for you. You can review your labs as soon as they come in. You can chat with your nurse coordinator or team because there's like a messaging system on there. So there's an enclosed instruction sheet included in your binder on how to set up an account, and our staff can also help you with that should you have any questions. So this section reviews some other common concerns. This is a little bit more social work and financial heavy. You'll be seeing both of those people before you go, so they can kind of clarify any questions on what is enclosed in these slides. So this is a review of what's in here. So these are some common concerns after transplant. So affording medications. Basically, we want to know as soon as possible if you are having difficulty affording medications for whatever reason. If your insurance coverage is changing, so even a small policy change can impact the coverage of medications, post-transplant care, where you need your meds filled, that kind of thing. So we can help you troubleshoot that, or if you anticipate losing your insurance coverage. Returning to work. So the goal of transplant is for you to return to a normal life. Everyone's different here where, you may go back to work in 6 weeks, you may go back to work in 12 weeks. So depending on what you do, talk to your transplant team about when it may be best for you to return to work, and let us know if we need to help with any paperwork for leave, whether it be for the patient or caregiver. Travel safety. If possible, we want you to wait about 6 months after transplant before traveling to really make sure everything's stable and happy and healthy. Of course, there are you know, things that pop up that you need to travel for, and that's okay. So just communicate that with us. You may still need labs while you're away if, it's during a sensitive time period in your transplant course. Looking into the future, if you're going overseas, if you're going to an exotic place that requires special vaccines, chat with us about that. We'll make sure those vaccines are safe for you. You may also need certain medications to prevent infections or to treat diarrhea if you're going anywhere like that. Other considerations, and think about time changes that may impact your med schedule. Never put meds in a checked bag. Always bring them on your carry-on in case you lose that luggage. And just be open and honest with us about your travel plans so that we can help you have a good trip and also stay safe. Temptations after transplant. So it can be tempting to either start or return to the use of cigarettes, alcohol, or drugs because it's stressful after transplant. It's not always an easy course. There's a lot of anxiety and depression associated post-transplant. And using these substances place you at risk for health issues and risks the health of your new kidney. So if you're experiencing, any depression, anxiety, use of cigarettes, alcohol, drugs, whatever it may be, please contact us. We have a great social work team and a lot of resources here. So the recovery process, it may not always be as quick as expected. It may not always be a downhill journey. There are a lot of bumps along the way. So just be mindful of that. It's going to get better. Just set realistic goals for your recovery. Certain post-transplant meds can affect your mood. These are usually temporary side effects. And side effects of anesthesia can make you feel sluggish for a while, which feels a lot like depression. So this goes over normal emotions. So anxiety and depression are common. It's very normal to feel overwhelmed. A lot of recipients worry about the health of their donor if they're a living donor or feel anxious about their own health. It's normal to worry about rejection or complications. And feelings of grief are common, especially if you received a deceased organ donor's kidney. So this just lists, where you can find support. You are one of millions of people who have gone through this, so it's good to be aware of that and know that there are a lot of resources, but then also include your own circle of caregivers, family, friends, and support teams. There are a lot of fun annual events in our area in Denver, but also nationwide. So ways to celebrate this community. So if you ever want to reach out to us to any upcoming activities, that kind of thing, please do so. We love to have our patients involved in our annual events and celebrate them. This lists some other resources available. So lots of groups, websites. This is a small list of a lot more resources out there. So please reach out to us. And then this is kind of our final thoughts. So share your thanks. So if you don't know your donor or your donor's family, we encourage you to take the opportunity to thank them when and if you are comfortable. So this is certainly not required of you, but if it's something you want to do, we very much encourage it. This can be done through a letter and arranged through our team. So let us know. We can provide more information if you're interested in doing this. This is a short synopsis of things to call us for. So if you are having any signs of rejection or infection, remember these can be similar. It's not your job to diagnose what's going on. It is your job to let us know you're not feeling good. And we can figure it out from there. So any signs of rejection, infection, a cough that won't go away, vomiting, or if you're unable to keep meds down, ongoing diarrhea, unable to pass urine, confusion, admission to any local hospital for any reason, before starting a new med, any change in your health. Basically, if in doubt, give us a shout. In summary, your future health and the health of your kidney are largely under your control. So take good care of yourself and the gift that you've been given. Establish a good relationship with your transplant team and other local healthcare providers, and be an active partner in your care. Like I said, you're going to chat with a lot more people, and if you have any questions about these slides, please ask your coordinator or bedside nurse. I appreciate you listening, and congratulations. Thanks.